These are perioperative complications in obese patients. Obese patients are predisposed to major perioperative complications like thromboembolic events. This can be a deep vein thrombosis that progresses to a pulmonary embolism. Patients that are obese should be getting prophylaxis, especially for longer procedures. They're also predisposed to respiratory complications. They can have airway obstruction that leads to hypoxemia and hypercarbia. They get rapid desaturation due to their decreased FRC, functional residual capacity, and they are at increased risk of having a difficult airway. They're also at higher risk for pulmonary aspiration. Obese people also are at risk for cardiovascular issues. They tend to have left ventricular hypertrophy, decreased functional capacity, and an increased risk of heart disease and hypertension. Other significant complications include wound infections. They're predisposed to infections, predisposed to hyperglycemia, which has its own list of perioperative complications, and increased gastric volumes with lower pH. There are some associated conditions with obesity that might further impact care: obstructive sleep apnea, higher risk for stroke, hyperlipidemia, osteoarthritis, and diabetes. So again, some key physiologic changes in obese patients: they have increased oxygen consumption, they have decreased lung volumes and decreased lung capacities, which makes them harder to pre-oxygenate and predisposes them to hypoxemia, and they have altered gastric contents, increased volume and lower pH that might make them aspirate and damage their lungs.